if there is any emergency, you should make sure first that the scene is safe for you. You should be safeguard yourself so that you can save the person's life. How you would check the responsiveness of the casualty? Tap on the shoulder gently and ask loudly if he's okay. Are you okay? Are you okay? When the person is not responsive, you should immediately tell someone to call an ambulance and the other person to bring an AED. How would you open the airway of the casualty? Put your 4 fingers over the forehead of the casualty, 2 fingers under the bony part of the chin, tilt the head down, lift the chin up. How you are going to open the airway of the casualty using jaw thrust maneuver. So you will have to keep the base of your thumb over the cheek of the person this way and your 2 fingers behind the jaw angle and lift the chin this way. This is jaw thrust maneuver. Why do you need to open the airway of the casualty? I will tell you the reason. Because when the person becomes unconscious, his tongue rolls back and it blocks the airway. If it blocks the air, he won't be able to hear his breathing and he will stop breathing after some time. And if he is in cardiac arrest, you won't be able to listen to the breath. You won't be able to diagnose. How you would check the breathing of the casualty once you find that the casualty is unresponsive. You open the airway first and then look at the chest movement to check the breathing. Do not bend over the mouth and the nose of the person as per the guideline of American Heart Association 2020. When you check the breathing, at the same time you should check the pulse of the casualty, that is carotid pulse, and you should not take more than 10 seconds when you check the breathing and the pulse simultaneously. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Find that the person is unconscious and he is not breathing, he is not having pulse, it means that the person has gone into cardiac arrest and he needs CPR immediately. How should be your hands position when you give compression in CPR? Your hand should be completely straight with your fingers spread apart. Then put one hand over the other hand, entangle your finger in this way and then give compression with the heel of your hand. Where is the location on the chest where you should give compression? This is the sternum bone of your body. It starts from here and ends here. Where your sternum bone ends, there you put your 3 fingers and leave that space. Here is the place where you should give compression at the rate of 100 to 120 per minute. Where should you give compression? The compression should be given in the center of the chest in lower 1/2 of the sternum. When you give compression, you bend over the victim exactly as your shoulders are above the victim's chest, with your shoulder, elbow and wrist in the straight line. Never bend your elbow and start giving compression at the rate of 100 to 120 per minute to the depth of 2 to 2.5 inches down. Give CPR, you should allow complete chest recoil during compression. What do you understand by complete chest recoil? Let's understand that. When you give compression, you compress at the center of the chest. When you go down, then you should come up at the level of the chest. Go down, come up at the level of the chest. Do not take your hands off the chest. So contact of the chest with your hand should remain constant. Okay, this way. This is called you are allowing complete chest recoil. So when you are allowing complete chest recoil, the heart is contracting when you are compressing, and the heart is relaxing when you are coming back to the level of the chest. Compressing, relaxing, compressing, relaxing. This way the heart is pumping blood so that the blood continuously reaches to the brain and to the rest of the body, and you keep the person alive by continuous compression. What is compression? Only CPR. You have to give only compression when you give CPR. You don't have to give mouth-to-mouth respiration as per the guideline of American Heart Association 2020. So you, as a lay person, you start giving compression and continue giving compression till you get the medical help or till the casualty shows any sign of life.